Awesome. Alrighty. And my question.
Okay.
So, good morning, Dr. Dunham. If you don't mind, I'm going to ask you a couple of questions to interview you about what it's like to be a clinical mental health counselor. I know you also do marriage and family work, so it's going to be a couple of questions. Don't want to take too much up of your time.
Okay.
So, what is your graduate degree specialty area? Where did you earn your degree and what year?
Okay. My degree is counselor education and supervision with a specialization in marriage and family therapy. I got my degree from the University of Akron in 2008.
Hmm. So, what professional credentials do you have, and then when did you earn them?
I have my LCPC from Illinois. I have my marriage and family therapy, and I'm licensed in Illinois and North Carolina. And I think 2020, 2019 or 2021, I can't remember.
Okay. Awesome. Was the process different from Illinois to North Carolina and getting licensure for both of these, or?
Yes, it was. Well, North Carolina was more strict on their clinical mental health license. They wanted to see syllabi. They were just making it really difficult. So I decided to just wait and do the endorsement in 5 years. My
Mhm.
marriage and family license was easy. That was no problem because I graduated from a K co-MFT program. I thought that North Carolina would be similar in the clinical mental health license because I came from a K-CREP accredited program, but it was not so.
Wow, that's interesting. I would think Illinois would be more difficult to get into for licensure.
Oh, no.
Hmm. Alrighty. Can you please describe your professional background?
Okay. So let me start off by saying I have every degree except for psychology and psychiatry. So I
Hmm.
started out in social work. I got my undergrad and my master's degree, my first master's degree in social work. Got attacked at work and said, this social work thing isn't working for me. Yeah. So I went back to get my doctorate, and they required me to get another master's in order to go into the doctoral program. So I did them at the same time. What was the next? What was the other part of that question?
Just your professional background. So all
Okay,
including.
okay. So I was a child care specialist. That's when I was doing more case management and social work. I've also worked on a psych ward as a trainee, and what else was I doing? And work with a psychiatrist called Dr. Carol North, who had schizophrenia herself. And we worked with patients that had schizophrenia and bipolar and borderline disorder. And we did electric convulsive therapy, which is ECT. I've done private practice. I've also worked with juvenile sex offenders. And what else? I think that's about it. I'm sure I'm missing something, but I think that's about it. Oh, and I did a little bit of addictions work.
Hmm. Okay. You're so pro marriage and family with throughout the program. It was different to hear that you had done like social work and then you were in the psychiatric ward working with like schizophrenia.
Yeah. Sometimes you got to go on that journey to find your passion.
Mhm. I believe that even in your classes, you're always like an advocate for, well, do you really like this niche? Like, go and try it out. Like, let's role play it.
Yeah.
How did you maintain your professional credentials?
So we have to get CEUs, which is continuing education, and I do go to conferences, and I also present at conferences. So that's how I maintain my licensure.
Awesome. When's the last conference you presented at and what did you present?
The last conference I presented at was two, the North Carolina American North Carolina American Association of Marriage and Family Therapy. I did something on cinema therapy in African American couples, and I presented on infidelity in couples, practitioners' understanding of infidelity and how to work with couples who have infidelity. And I did that at the North Carolina Association of North Carolina Counseling Association.
Oh, that's interesting. Sounds like a very neat topic. What was the most challenging aspect of becoming a professional counselor, both in Illinois and in North Carolina?
Well, Illinois, the test was really hard.
Mhm.
So that was the challenge. And then um, the challenge of North Carolina was they wouldn't give me my license, even though I had taken the test. I had a degree, I had a license in Illinois. They wouldn't give me my license easily. So they was making me jump through a lot of hoops. My marriage and family therapy exam was hard, but it was just different from the clinical mental health exam, the NCE. It was just, but also we take two tests in Illinois. We take the NCE and then we take a clinical exam, which is really focused on not definitions, but how you apply what you know.
That's interesting. I feel like it's an interesting test taking strategy, but it also makes sure that you know you're not just memorizing the work, you can also apply it in action, which is really good.
Right.
Mhm. What advice would you give yourself if you were a new licensed clinical mental health counselor associate?
What would I give myself? Hmm. Keep learning. Keep learning. I think I wish somebody would have told me how it's so important that when you're in school that you pay attention, you really get immersed in the content and the curriculum and really learn as much as you can. So at the associate level, I would just encourage you two things. Keep learning. Well, three things. Keep learning, get supervision, and get a mentor.
Awesome. Alrighty, our next question. Describe the most outstanding ethical dilemma that you faced as a professional counselor and how did you handle it?
So I had to think about this. I was working for a private practice, and they were doing some basically lying about charging like Medicaid and Medicare fraud, doing some things that I didn't agree with, and I just anonymously reported them
That's
because you have to sign off on things on certain things, and so I was worried that something may come back and I didn't know how I would be connected to it because at that time I was working on my licensure and I was working under somebody. And so it was a hard decision to make because if I turned them in, then I wouldn't have a supervisor.
yeah.
So, but they were basically doing, billing fraud,
Mhm.
medical and Medicaid billing fraud. So I just reported them anonymously.
And that's good, especially with learning that you were under somebody, you still managed to protect yourself and your license too.
Mm-hmm.
Where do you see yourself in 5 years? And then where do you see yourself in 10 years?
Um, 5 years, I see myself opening up a practice. In 10 years, I'm hoping to open up a center. I
Mm.
already have a private practice, but I want to do more mentoring than seeing clients. I want to do more mentoring and supervision, for future counselors. And then for 10 years, I want to have a center that does a lot of wraparound services that you come there and it's a one shop stop.
Yes. Would you see yourself having your practice partner with A&T so you can like take on your students in that mentorship kind of way?
Possibly if it's not a conflict of interest, because I would have be teaching or have taught a lot of the students there.
Mhm. That is true. Next question would be, what advice do you have for me as a person preparing for a career in clinical mental health counseling? And also, as you know, I'm gonna add on as someone who also wants to pursue the same path you did of doing marriage and family therapy as well.
Um, Kind of like that question you asked me before, and I told you the three things is Tanaya, after you graduate school, people don't invest in learning as much.
Hmm.
So stay very connected to the field, learn as much as you can while you're in school, and continue that process when you graduate. Just continue to learn. And those three things: learn, supervision, and mentorship. Just remember that those are so important. I have what, two mentors that have been with me for a very long time. I have the top therapist in emotionally focused therapy. That's my mentor. He's my mentor for EFT and he's my mentor for the certification. So it has been invaluable to keep connected. And I still learn. I still learn because, he's been doing this way longer than I have. And so those are the things I can say that you definitely need to do on your process. Learn, learn, learn. And when you finish the process of education, continue to learn, seek out additional supervisor. You should have a supervisor in your back pocket that you can call and be like, hey, how to navigate this.
Hmm.
And have a mentor to continue teaching you about your model, keep teaching you about the field, so those are the things I highly recommend and say that's the best advice that somebody gave me.
Hmm. Awesome. And
But they
then,
didn't give it to me. I kind of, somebody said something about it, and I kind of, kind of filled in the blanks.
hmm and then, excuse me. My last question for you is what, in your own path and all of your knowledge, how would you direct somebody on the path of doing a marriage and family work through the A&T program, even though the program is set up for being a licensed clinical mental health counselor?
Well, one thing is the certificate is a great start
Mhm.
because you can say, hey, I specialize in marriage and family counseling. I have a certificate that supports that. Marriage and family therapy, you will have to do a little bit of coursework and get supervision from a marriage and family therapist to become a licensed marriage and family therapist. It's not hard, but it does take some time.
Okay. Awesome. 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 That is the last of my questions, Dr. Dunham. You've been an amazing person to interview. This is so knowledgeable.
Great. I'm glad I can be helpful.
Yes. I'm going to stop the recording now.